Hello and welcome to One on One. I am Cyril Stober. The search continues for the cure and vaccine for COVID-19 that has continued to ravage the world. Now here in Nigeria, figures are rising and the risks associated with the disease are beginning to be more pronounced. And even as we speak, the fears about a community transmission are beginning to be real. My guest today is a public health specialist who spent many years at the United Nations. Let's welcome Dr. Isaac Akuma Egboja. Dr. Egboja, thanks for being on One on One.
You're welcome. Good morning.
Right. How real is the community transmission of COVID-19?
I think it's getting real. The figures we are getting now, both in Lagos and in Kano, especially in Kano, where the figures are spiraling up on a daily basis, is indicating that community transmission is real. And we are likely going to see a little more of that. We don't pray for it, but it's likely going to be so.
Well, initially, quite a number of people thought this was a disease that was confined to high net worth individuals, people who had embarked on travel to other parts of the world, the elderly. And so accepting the dangers of COVID-19 was difficult initially for so many Nigerians. But now the idea is beginning to change. And the worst fears that this disease might very well ravage communities if care is not taken. So how can the country avoid an explosion of COVID-19 cases all around?
Okay, I think that the thought or the belief at the beginning was correct. It was indeed a disease brought from another country to this country. The index case we had came from Italy, and most of the cases that we recorded subsequently in Lagos in particular were all people who came from abroad, largely UK, and some from the US and from France and Italy. So that belief is true. It was imported to us, but this is how coronavirus has spread around the whole world. It has spread it started in China. From China it went to other countries, and from one country to the other. Even those countries that didn't initially record any case are now recording cases. So it is true that it is the transmission is from one country to the other. And I think this is one of the reasons why in Nigeria, the number of cases we have till today is relatively low, fortunately lower than we would have expected. The reason being that the Nigerian authorities took very proactive actions. They made sure that those who were coming from abroad were screened, they were isolated where necessary, and they were able to identify those who had cases or who were likely to have cases, and they were following them up. This has helped tremendously. If this was not done, by now I'm sure our cases would have been worse than what we are thinking or what we are seeing. Yes, the second part of your question. The community transmission of the nature of the virus is such that when once one person or two gets the virus, it will spread around very quickly. And the worry in our own environment is the fact that we live in very closed communities. We interact with each other, either voluntarily or involuntarily. Involuntarily meaning in a household, for example, you might find 10 people, 15 people, and in a compound, you may even find up to 100 people in a compound. And if one person in that compound, an enclosed compound, for example, gets the virus, the likelihood of that person spreading it to others is very high. And this is one of the worries that we have. And this is one of the reasons why we here in Nigeria have to be particularly, at this time, be more careful, be more willing to adapt to the new way of life, to be more willing to listen to those who are telling us what to do and to comply. We have no choice. The choice is either you comply and you live, or you neglect and you die. And I'm sure nobody wants to die.
Right, there are two issues here which we might take up. The first has to do with the relatively low figures that have been recorded in Nigeria. But is there a relationship between the number of discovered cases and the number of tests that have been carried out? Some would say, well, if you're not testing on a wide scale, then you're not likely to find huge numbers. And they tend to point to the fact that now that Lagos State, for instance, has changed a strategy and is embarking on what it calls door-to-door testing, figures have suddenly shot up. And even in the FCT, where the authorities have started going to communities to run tests, the figures initially jumped up.
Yes. The answer to that question is yes and no. Let me start with the no. Initially, when we recorded the first case in Nigeria, if you go around the country, go around Lagos, come to Abuja, go to Kano, go to all these other places, and look for cases, at that point, I'm almost sure you would not find. And if you did, it would be probably one or two. It is because more people have been coming from abroad. And the more people you bring, the more likelihood you get of the disease spreading. It is even worse because this is a virus that somebody can get and it may not manifest immediately. And there are some people who are carriers who can infect others, but they are not sick. So if you screen them, for example, you would find that they are negative by screening. They are not showing any sign, any symptoms of the disease unless you test them.
Right.
Okay. Now, this is the reason why I say no. If at the beginning and before the first case that we had, you go around testing, you're not likely to see what you're seeing now. The yes now of part of the question is the fact that yes, because we have had more influx of people coming in from different countries, and even within the country, those who may have had contact with those who were infected, knowingly or unknowingly, and may have traveled to other places, have certainly carried them around. If you see the way in some states, like the case of Kwara, as an example, it came from somewhere else. The case of Katsina came from somewhere else. The case of Kano, the same. And was it not yesterday or the day before, we heard of a case of somebody who was infected in Kano and traveled to some other state. So this, the Adamawa recorded a case, was it yesterday or the day before? And it was an imported case from another state to Adamawa. Adamawa, hence, before that time, did not have one. Okay, now, if we are more careful with ourselves, are more honest with ourselves, and are able to disclose our travel history, travel within the country, our contacts, because NCDC did an excellent job. It made sure that the contacts of our index case and the subsequent ones were all recorded, were all traced, were all tested. That wasn't a small job to do. And if it were not for that, by now, it would have exploded. So the truth remains that as long as people are moving around, we have the likelihood of the pandemic spreading within the country. And this is one of the reasons why we have this lockdown. The lockdown is not supposed to be a punishment, and it is not intended to be a punishment to anybody. The government is not punishing anybody. The president who is saying you shouldn't go around is also not going around himself. He's washing his hands. He's obeying the rules. He's keeping the instructions given by the health authorities. And so every one of us have to understand that this lockdown is for our own benefit. Unfortunately, in Nigeria, you see how people traveling at night in order to avoid being caught or being seen by those who are checking and those who are controlling or enforcing the lockdown. For goodness sake, isn't it a fact that those people are jeopardizing their own lives and the lives of those that they travel with and their own families? If you leave Abuja in the night because nobody will see you and arrest you, and you go to Enugu or you go to Lagos and you arrive there in the morning and you sneak into your house and you traveled with somebody who had it in the bus, for example, and you enter your house, aren't you jeopardizing or risking the lives of the people in your family? These are the things that people need to worry about. Okay. And we really seriously need to worry about this. We are told to stay put where we are in our houses because that is the best way to contain this virus.
All right, then, well, added to that, there are also challenges, especially to do with the social distancing, lockdown. But let's look at social distancing as a measure. Now, you have just said yourself that closed communities are a feature in this part of the world. And so, how easy would it be, or how difficult, or whichever way you look at it, to carry out social distancing in the closed communities? You gave examples of having a compound with so many people, having what we call, in local parlance, face me or face you apartments. Some one-room apartments have up to 5 or 6 people staying in them. And, you know, there are clusters of all these around. How would they practice social distancing? And also the question of certain social amenities that may be absent and make it more difficult for people in such communities to engage in hand washing, regular hand washing on the running water. Some don't even have running water to start with. This is the fear of many people.
Yes, it is true. And if it is true that we live in clusters, fortunately. I say fortunately because if, for example, you have a compound of face me, I face you, as it is in Nigeria, say take Mararaba or Nyanya or any of the suburbs of Abuja, for example, a compound where there are maybe up to 20 people in the compound, in households, living in a condition of face me, I face you. The advantage in every situation, by the way, in life, there is always a window of opportunity. There's always something you can gain. There's always something you can utilize. In this case, yes, it is a bad situation. That in such a situation, social distancing, physical distancing is difficult, but it is not impossible. And for the health workers, there is an advantage. That's a window of opportunity. What is that window? The fact that these people live in a cluster, in a compound. If one person in that compound gets infected, it is easier for the health workers in that locality to go and quarantine or isolate everybody in that compound than if they were to be roaming about. So it is not totally a disaster. It is bad, I agree, but it's not totally a disaster. We can still make use of the fact that because it is an enclosed compound and 1 or 2 persons are infected in that compound, we will be able to round up everybody there. That's what the police does in a crime. They punch a group of criminals, and because they're all together, they are able to arrest them. In this case, because the people at risk are in the same community, the same compound, it is easier for the health workers to trace them, to isolate them, to test them. So that's the window of opportunity we have. Now, coming to the amenities that you talk about, yes, it is true, especially water. If the same communities that I've just mentioned, Mararaba, Nyanya, and others, many of these compounds don't have running water. They use water from the well. And even at that, some compounds don't even have wells. They buy from neighboring houses or neighboring places where there is running water. Okay, true. If they are locked in their compound and they run out of water, how do they get water from the next compound from where they used to get water? Or how does the Merua or the water person that used to come around with a wheelbarrow or whatever to give them water, gives them water this time? It is difficult. But let's look at it this way. I'm sure those who are complaining have points, yes. But if you have been faced in war, if you have ever gone to war front, I don't know whether I would call it a privilege or whatever, but I have had maybe a privilege of going to the war front once, more than once. And believe you me, the issue of hunger doesn't even arise. You're not worried about being hungry at the war front. You're worried about how you would make it through the day, how you would succeed in saving yourself, and if possible, those around you. Yes, there is hunger, I agree. Yes, there is need. There are various needs that we have, I agree. But when you are faced with danger, you may have to make do with the little that you have. Indeed, if you don't have running water in your compound, and you need somebody else to bring to you, and that somebody else is locked up in his own compound too, you are in trouble. And I think this brings us to a point where I believe that after this pandemic, the world will change. I believe too that Nigeria will change. I think too that the same authorities now that are finding it difficult to get their citizens to comply with a necessity. What is the necessity? Stay in your house, lockdown. It is not, like I said, the government is not doing it because they enjoy doing it. They're doing it because it's a necessity. That's the only way they can keep the citizens safe. These same authorities now would have no choice but to think of how best to live, how best to distribute social amenities, how best to cater for citizens. Do we wait until we have disasters, emergencies, crises, before we look out for solutions? Or do we take proactive actions and try to provide, envisaging that there could be a problem at some point in life, because life is full of problems, and particularly in view and in the face of emerging diseases that we are facing. Before this virus, you remember we had Ebola. We've been having Lassa fever. We've been having this problem or that problem, some localized, cholera epidemic here and there, and so on. I think it is an opportunity for our authorities to also look more carefully at better ways of making sure that we don't wait until we have crisis before we start solving problems.
Right. Some of the strategies adopted to check the spread of COVID-19, the lockdown, for instance, and some states, well, virtually all the states across the country have taken such measures. Let's look at an example here in the FCT, and why people say that these strategies also throw up challenges of their own. For instance, the restriction of markets. 2 days at some point in time in the FCT, for instance, in Egboja, markets are confined to 2 days. But you do find out that while people have stayed at home all through, on those market days, people want to go out and make purchases. There are people whose livelihoods are daily. No one talks about savings. And so huge crowds turn out in the marketplaces, thereby jeopardizing the whole idea of the restriction of movements in the first place. Now, how do you control that? People have to. Some parts of the FCT are luckier than others, where initially the planning of Abuja had neighborhood markets, but it's not the same all over. And so you find people stay in certain areas where they have to go long distances. How do you manage a crowd that wants to get essential, items to help them in the period of lockdown?
I think that rather than thinking of how to manage the crowd, I would suggest that the crowd tries to manage itself. I hear everybody complaining, the government should do this for us. The government should do that for us. I agree. There are things that we expect the government to do for us. But I also want us to recognize that there are things that we can do for ourselves. If somebody gives you food, that person does not necessarily have to cook the food for you. And even if the person cooks the food for you, that person does not necessarily have to put the food in your mouth. Unless you are sick. You should be able to feed yourself. Unless you are sick. What do I mean by doing things for ourselves? Do we need to be forced to do things? Do we need to be forced to obey rules? Do we need to be forced to run away from danger when we see danger? The ideal thing to do is, if Tuesday, for example, for people in Nyanya, let's give an example of Nyanya. If Tuesday or Wednesday is their market day, if Wednesday is the day that they're allowed to go and restock, buy things for themselves from 10 o'clock to 2 o'clock in the afternoon. Do people need to fight to go out? Do people need to fight to buy? If, for example, we are disciplined people, as a people, we are law-abiding, there is still an opportunity for us to behave ourselves, and that is what the government is telling us to do. We know it is difficult. We know it is a pain, especially for women who have children that are crying. We understand. But the government is telling us, we know it is difficult, but try. And we as citizens have to try. We have to be self-disciplined. We have to look at the need of those around us. I went to the bank one time, and 3 of us were standing, waiting to be served. Somebody came, and right in front of me, to my left, threw his check and stood in front of me. For goodness sake, there were 2 ladies behind me. He did not care about, and one of the ladies, the second lady behind was pregnant, very pregnant. This man did not care about the fact that I was in front of him. He did not care about the fact that there were 3 of us. By the way, when this pregnant lady came, and I looked back and I saw her, and she looked heavy, I told her, Madam, would you like to come to the front and get your money before me? And she said, no, I have already told them I was here before. They are going to give me my money now. So I relaxed. Okay, why did I do that? Because I realized that this woman was pregnant. She did not have the stamina that I had to stand. And I should give her priority. Okay. Now this man came. He didn't care about the fact that we were there before him. He jumped in front of us. And I simply told the cashier at the bank, who was trying to serve him. And what he did, he took his check, and he decided now to serve the 4 of us together. And I said, no, that's wrong. Okay.
So
this man should go to the back. Okay, now what am I driving at? If we go to the market, men and women, old and young, and the young ones find that there's an old lady who is fragile, who is frail, or there's a pregnant woman, or you look at a woman who is probably a lactating woman, she's breastfeeding. Why can't we be civil, be considerate enough to say, let that person go before me? Why must we have to fight the survival of the fittest and push somebody away? Why must the man push the lady away? Should it happen? So if the government is doing for us, we too should do for ourselves and also do for the government. Right. By doing this, we are encouraging the government to do more. Look at the palliatives they are giving. Look at the food that they are sharing. I watched one case where a vehicle arrived in a community, and the three people who were there to share the food were almost trampled upon by those who came, who were supposed to be beneficiaries of this food. Why should that happen? These people in the first place have risked their lives, brought the food to your community, are ready to share. You are not even giving them a chance to do the work they are supposed to do, even when they are already risking their lives. You are pushing them down, you are taking the food by yourself, and making sure that it is only you who has the food and your neighbors could die.
Well, what you have just spoken about, Dr. Egboja, has to do with the people's attitude, especially when you talk of the matter of distributing palliatives. You find, as they say, people who have been so hungry and do not have access to funds are likely to behave in a rowdy manner when they see some help coming, in the belief that there may not be enough to go around, and so it's more or less a survival of the fittest. In this case, would you say enough enlightenment has been carried out, especially in the suburbs, in those densely populated communities? Has enough enlightenment been carried out to sensitize the people to the dangers of crowding and being patient and receiving their palliatives in an orderly manner? Because it's looking so difficult to manage people who have been, let's use the word for want of a better word, deprived of so many things for days.
I agree, but I still insist. Much that it is true that it is very difficult to control a crowd, especially a crowd of hungry people. The point I'm trying to bring home is the fact that we as a people, we Nigerians, need to be more disciplined. If you happen to have gone to a place where they are voting during election, where it is supposed to be a line, and where you have a chance that when it is your turn, you will present your card, and you will be given accreditation, and after which you would vote, people are still struggling. People are still pushing each other down. We need to have that attitude of being disciplined. That's the point I'm trying to drive down. Why do we have to wait until we are forced to do things? Coming to the Enlightenment, yes, we can do more. But fortunately about this epidemic, about this pandemic, coronavirus, I think messages have gone out quite a bit, if not quite a lot. And I cannot think of any community now in this country which has not heard of the coronavirus. Some people have heard more than others, yes. Some people have been more enlightened than others, yes. Some communities may not have had enough opportunity to receive the message as clearly and as repeatedly as they should, I agree. But as a people, if we are disciplined, if we have this attitude of looking out for each other and making sure that what is good for me is good for another person, as a way of life, it would make things more easier for us and for the authorities that are trying to cater for us. I'm particularly worried, and I want to repeat again and again. Do you know that even when, let me give an example. When we were doing immunization campaign, and we had spent days sensitizing people, a particular locality, a particular local government, for example, informing them that at so time, on so day, the people who will be carrying out the immunization would arrive. And people should come out with their children. And the pregnant women should come out too. Do you know when it is time, people are still fighting? Even the pregnant women are fighting themselves. The women who came with their children, or who come with their children because it still goes on to today, still fight themselves. You wonder, if we have this inherent or learned attitude in us, and we are a little bit more civil, a little bit more concerned about our neighbors, shouldn't it be a case or a situation where we say, okay, this lady is here just like I'm here to receive what I'm here to receive too. So it doesn't matter whether it is she first or it is me first. As long as one of us takes, the remaining will go to the rest. See, each time we struggle, we get less. You notice in our roads here in Abuja, Abuja has one of the best streets that you can think of anywhere in the world. I've been privileged to go around the world. And I can tell you, the streets in Abuja compare with any other. I'm not saying it is better than a lot, but it is good. The situation in Abuja is good. The streets are excellent. Yet, when there is no light, and when the policeman is not around, and people have to pass a cross-section, an intersection, instead of one person to pass, one car to pass, so that the next will pass, everybody wants to pass at the same time. At the end of the day, everybody is locked up, nobody passes.
So attitudinal change
Yes.
is essential
That is
in
critical.
fighting this pandemic.
That is critical.
Now let's shift focus a little bit. Now, we've talked about people in the communities. What about health workers who have to interact with the communities, especially now that we're seeing this transmission in the communities? What would you say for health workers who need to be in these communities and assist, either enlightening them or guiding them on how to stay safe, putting themselves in harm's way as well? What would you say to those ones?
First, let me use this opportunity to thank all health workers, starting from the doctors to the nurses to the pharmacists to the lab scientists, lab technicians, to the cleaners, to everybody that works in the health facility, especially those who are in the front line in the isolated isolation centers, those in the ICUs, those who are directly treating coronavirus cases. Let me thank them from the bottom of my heart, because people don't ever seem to know the risks that these people go through and the emotional shake-offs that they go through. These are people who would want to stay at home with their family, but they can't. Many of those, especially those of them who work in isolation units, in infectious disease units, can't go home. Many of them stay in the hospital for days. They're isolated. You quarantine somebody, you isolate somebody and he's complaining. The health worker is literally, by the nature of his or her job, is already quarantined because he or she cannot go home. He or she would want to go to work in the morning or in the evening and come back in the morning, or go in the morning and come back in the evening, but they cannot do that. Many of these people spend days, sometimes now weeks, without going home, without seeing their families. And this is a sacrifice that they are making. And those of us who are privileged to be beneficiaries of these services should be grateful enough to be orderly, to try to save them, to try to keep them alive, so that they too can serve us better. For the health workers who are going out to screen in communities, I plead with all of us to maintain a distance from them and to listen to them. If they tell you, you stand here, you stand here, you stand here, you stand there, away from yourself so that you're not crowded. And I will call this person, I will call this person, I will call this person. When I call this person, the person behind move to the position of this person. When I call this person, the person behind move to the position of this person, and let it go around. We should listen. We should comply. We should obey. Because after all, it is for our own benefit. And let me tell you something. These health workers have families. It is not only their lives. They have to risk their own lives, risk the lives of their own families, and their own loved ones, and friends, and so on. So, wherever we find them, let's support them. Let's make their work easy or easier. It is already difficult, but let's not make it more difficult than it could be or than it is now.
Well, let's, as we begin to round off, let's look at strategies that people in such populated communities and in crowded settings can help themselves. What should they do beyond the hand washing, the regular hand washing, and well, they might not have access to alcohol-based sanitizers, which, by the way, have become very expensive now. And so, what are the simple things they should do in their surroundings as to promote environmental health and help themselves stay healthy?
Very excellent question. Okay, if they don't have sanitizers, for example, and they have water, let them wash their hands as frequently as possible. But more importantly, let them distance themselves from each other. This is the message that is most important about this. Yes, it is necessary for you to wash your hands. Yes, it is necessary for you to use sanitizers. But it is even more necessary, more mandatory for us to keep distances from ourselves. Because if, for example, you are about 2.5 feet away from me, let's call it 2 feet away from me. If you are coughing, if you have the virus and you are coughing, for example, and I'm here, the likelihood of me getting the virus from you is 0. Because the droplets that are coming from you will not reach me. If, however, I wash my hands, I sanitize my hands and so on, but I'm very close to you, and you have the virus, and you are coughing into my face, the likelihood of me getting the disease is higher. If you don't find sanitizer, use whatever you can use to wash your hands. Use soap. If for any reason you run out of soap, you know something that you can use? Ash. I know many of us don't cook with wood, so we don't have ashes. But it is something you can use to wash your hands. If you don't have anything at all, and you have water, use the water. And make sure that you don't reuse the water that you have used. Don't wash your hands into the bucket or into a bowl and scoop it and use it again. Wash and dispose the water. In other words, keep your hand. If somebody needs to pour the water on you, let the person pour it on you and you wash, and the water runs away. And if you use a face mask, and you need to dispose it properly. If you are in a crowded community like we are talking about, burn it. Don't just throw it away, burn it.
Because we're beginning to see people...
Because if you throw it away...
We're beginning to see people picking up discarded face masks, washing them, and passing them off to unsuspecting people.
Yes. If you live in this kind of communities like Mararaba, Nyanya, and so on, Mpape, or whatever part of Lagos or wherever you are, Kanu, where people are crowded, and you wear a face mask, and you need to dispose of it, please burn it. It is better than for you to throw it and somebody picks it and uses it again.
All right. Dr. Egboja, COVID-19 has brought to the fore the need for personal hygiene, cleanliness, and all that. How so can we improve that in our communities, especially in slum areas that build up around cities? Because you see, you have the cities, yes, Abuja, well planned and all that, but there are all kinds of communities where the people who service this beautiful city live in. And the truth is, there are many slum areas around and on the fringes of the so-called planned cities. Cleanliness, healthy environment, how so has COVID-19 brought this to our doorsteps?
Yes, like they say, cleanliness is next to holiness. I think too that this incidence of coronavirus is teaching us a lot of lessons, both as people and as authorities. We need now to see more reason why. We know when Abuja was planned, it was properly planned. People came and lived anyhow. One of the ministers that came and tried to sanitize the place and make sure that things were orderly, and they removed buildings and structures and so on, they called him all kinds of names. I think those who were giving Rufai all the bad names would probably be singing his good name now. Because we are seeing reasons why, when the authorities say don't do this, they are doing it for your own sake. They are saying it for your own sake. They see what you don't see. And the reason for us to plan our cities well is becoming more real for us. The reason for us to be more, to be healthy, because we are clean, because we are hygienic, because we practice hygiene, is becoming more real. And the relationship between our environment and our health is becoming more real. If you look at the Ministry of Health and the Ministry of Environment, right now in Abuja, right now in Nigeria, they're working hand in hand. The Ministry of Environment is going around sanitizing places. I have been for long advocating for the community health workers, environmental health workers, to be trained in larger number than we have. You know, when I was younger, I've said this over and over, and I want to use this opportunity to say it again. I used to see these environmental health workers with their beautiful uniform in markets, trying to make sure that people don't sell dead animals.
They do have them now.
People don't sell bad food. We have, but we don't have as many as we are supposed to have, and we are not using them as we are supposed to use them. In fact, for some years now, if you go to the market, you don't see any of them. When I was young, I used to see them in my own local market in the village. I used to see them. Every market day, they will come around. And they will make sure that those women who were cooking food in the market were inspected. For some time now, we didn't see them. And I'm glad that recently we've been seeing quite a number of them coming out to talk and to perform their duties. We need to train more of these people. But much that is needed, I want to pass a message. One, we need to plan our cities better than we are. We need to be more orderly in our public life. We need to plan our lives better too. We need to be more hygienic in our private lives. We need to look at personal hygiene, and the issue of health should be taken more seriously than we have been doing. This pandemic should teach us the lesson that whether you are a big man or you are a small man, whether you are a poor man or a rich man, whether you live in town or in village, health remains health, and it is relevant to everybody. And we need now, from now on, after this pandemic is over, to sit down, plan properly, plan everything from both our towns, our cities, our streets, our lives, the way we distribute amenities, the way we share what belongs to everybody, whether you are talking of drugs in the clinics, whether you are talking of food, whether you are talking of farm inputs. By the way, we didn't have a chance to talk about farmers, but whatever it is that we are going to share for people, let's plan properly and make sure that everybody who is a target beneficiary gets what the person deserves. And let us look out for each other.
As you did say, we would round off with the farmers, who are an invaluable segment of society and the communities. This disease, it's been said, is capable of putting the world in a food crisis, promoting hunger. So the farmers, yes, you do have them in mind. As this disease continues to ravage the world and getting into the communities, let's talk about the farmers as we round off this one.
Okay, the farmers need to be able to go and do their jobs. It is unfortunate that there's a lockdown, and we pray that as soon as possible we can get out of this, and it will not be too late yet for them to do what they need to do so that next year we can have food. Unfortunately, this lockdown is coming at a time when we are supposed to be planting. This is the beginning, last month, March.
Right. So
April, May, and June.
That's
is the
one
correct
aspect of the restriction.
Yes, is the correct time for us to plant. Unfortunately, it is also the time that this pandemic has come on us. But my appeal to everybody is this. Let's still do what the government is telling us to do. And let's look at it this way. If you were a farmer and there was war in your village, and there was shooting, people are shooting everywhere, would you come out with your hoe and machete and dare the bullets and go to the farm? Or would you rather take care of yourself and fight the enemy so that the quicker you win and drive the enemy, the better for you so that you can go back to your farm? That's a good question. As we run up, let me also use this opportunity. I think it is also time and opportunity for us. While we are talking of farming, for me as a doctor, my own farm is medicine, is people's health. The pharmacist's farm is his pharmacy and the factory where the drugs and vaccines are produced. After this pandemic, we as a people, we as a country, need to sit down. We need to look at our research institutes, the Nigerian Medical Research Institute, the Nigerian Pharmaceutical Research and Development Agency, and all related, health-related agencies. We need to look at them more critically. We need to look at our universities, our faculties, and make sure that we coordinate very well, coordinate our researches, coordinate our findings, utilize whatever results we've got in the past, and whatever results we would get from now on, to make sure that we produce our own vaccines, we produce our own drugs, we produce our own supplies, medical supplies that we need. You notice now that even face masks, we don't have enough. Sanitizers, we don't have enough. And not because Nigeria cannot produce these things, but because they have been neglected in the past. Lastly, the health budget. If you wake me 3 a.m. in the morning and you ask me, what would you want the Nigerian government to do as a priority in this country, without thinking twice, my direct answer to you would be, please, at all levels, increase the health budget. Federal level, state level, local government level. I have been singing about this, and I'm continuing to sing about this. We need more money for us to stay healthy. It has been a shame that people leave our country to go to other countries for treatment when we can treat ourselves here. I trained in America, and when I was in America as a medical student, there were many Nigerian doctors that came to specialize. And I tell you, they were as good as any other doctor. They were as good as those of us who were trained in America. The problem is not the intellect of the Nigerian. The problem is the facility that they don't have. Okay. And the government needs to look at this very critically. We need to coordinate very well. We need to produce our vaccines. We need to produce our drugs. We need to produce our medical supplies. We need to equip our hospitals. Okay. This is compulsory.
Well, I'd like to go back quickly, round off with the issue of the farmers too. There's a suggestion that has been made for some leeway to be given to those who are involved in the production of food. Yes, even with the lockdown, the concession is for people to buy food. The commercial concerns that are allowed to operate are those that deal in food. Those who have an exemption apart from essential service workers are those moving food supplies across. So it's been a suggestion, why not also create a concession for active farmers who produce the food? Otherwise, as you have noticed yourself, the planting season is upon us. And if this continues, then people are looking at, as they say these days, something that is as devastating as COVID-19, hunger and starvation. What do you say to that?
Well, I think you have said it all. Apart from the fact that we need food to eat, we even need food to sell. Now that we don't have any much money revenue coming from oil. When the budget for 2020 was planned, it was planned at $57 a barrel. Now, the oil has come to less than half of that money. In fact, from what I'm hearing, the cost of producing a barrel of oil is more than the value of the barrel of oil itself. So you ask yourself, is it worth producing it at all? And when you do produce it, now who is buying? Nobody is buying because everybody is locked up. I think this is a wake-up call. This pandemic is a wake-up call. We need to give more priorities to agriculture. And I'm glad that Nigeria is already doing that. This government in particular has been doing that. And I pray that they continue to do it. And for the farmers, we need to give them incentives. And we need to give them incentives in such a way that the young people who are running away from farming, we look at farming as a business, as a way of life, as a profession, and nothing to be ashamed of. Everywhere you go and you look to the bush and see those who are working in the farms, they are old ladies, old men. These people have expired. They have already utilized their own lifetime farming so that we can eat. It is now our turn to take over from them. If you ask me, if you were a leader of this country today and you are giving money and you say, share this money among the 3 priority ministries, close your eyes and forget about all others. Do you know what I would do? I would go first to Minister of Education. Because if you don't have education, all these other things are zero. You cannot be a doctor if you are not educated. You cannot be a good farmer if you are not educated. I would then give to Minister of Health. Then I will give to Minister of Agriculture. These 3 ministries must not be played with. They must have the lion's share of our budgets. It is necessary. It is not even an issue that we should debate about because it is obvious. And I'm hoping that after this pandemic, an opportunity will be for everybody now to sit down and evaluate what we are doing. I'm not saying other ministries are not important, but some ministries are more important, and we should give priority to these ministries. And coming back home, if you are hungry, you will die. If you are sick, you will also die. So these 2 ministries, let them take the lion's share.
All right. So I would like to leave it at this point here. And thank you very much, Dr. Egboja, for coming on One-on-One, talk about how to keep safe. We hope to speak with you again in the future, even as the world tries to surmount this pandemic. Thank you very much, Dr. Isaac Akuma Egboja, Public Health Specialist. Thank you.
Thank you for having me. It's my pleasure.
And that's our program today. We thank you for watching. Next week, we'll be back with One-on-One. I am Cyril Stober. Stay safe.